In this video, I will tell you about the new coronavirus variant. Lambda is a new coronavirus variant that is confusing scientists because of its abnormal mutations. According to the Financial Times, Lambda, the latest coronavirus mutant to grab the World Health Organization's interest, has left experts scratching their brains over its unique collection of mutations. The virus was discovered in Peru and has now spread to 27 nations, including the United Kingdom. C37 was its initial title. According to Reuters, Public Health England, PHE, discovered 6 cases of the variant between February 23 and June 7, 5 of which had traveled internationally. Pablo Tsukayama, a doctor of molecular biology at Peru's Cayetano Heredia University, claimed the variation only accounted for 1 out of every 200 samples when it initially drew the notice of doctors in December. By March, however, it accounted for over 50% of Lima's samples, and it is currently approximately 80%. That would imply that its rate of transmission is higher than that of other variants, he explained. According to the Financial Times, Lambda accounted for 82% of new COVID-19 cases in May and June in Peru, which is the highest coronavirus fatality rate in the world. It has also had a catastrophic impact on neighboring Chile, accounting for roughly a third of new cases there. Now the question arises, is it more contagious than other variants? Scientists have yet to determine if Lambda's abnormalities make it more transmissible. At the moment, there is no indication that it is more aggressive than other variants, said Jairo Mendez Rico, a Pan-American Health Organization consultant on new viral illnesses, PAHO. It is suspected that it has a greater risk of infection, but further research is needed. The WHO classified Lambda as the 6th variant of interest so far in June. The Global Health Organization feels that the other 4 more widely reported strains, Alpha, Beta, Gamma, and Delta, which were discovered in the United Kingdom, South Africa, Brazil, and India, respectively, are of more concern. The Lambda version, on the other hand, should be constantly monitored, according to the report. Following the WHO's statement, the PHE stated on June 23 that Lambda is a variant under investigation due to worldwide spread and many significant alterations. It was noted, however, that no evidence pointed to it being a more severe version of the disease or one that reduces the efficiency of vaccinations. According to the Financial Times, one reason why it is difficult to make sense of the threat from Lambda using computational and lab data is that it has a rather unusual set of mutations compared to other variants, according to Jeff Barrett, director of the COVID-19 Genomics Initiative at the Wellcome Sanger Institute in the UK. According to the Financial Times, Lambda has a unique pattern of 7 mutations in its spike protein, which it utilizes to infect human cells. One mutation, L452Q, is related to the L452R mutation, which is thought to contribute to the Delta variant's high infectiousness. Monica Acevedo and her colleagues at the University of Chile in Santiago conducted a study in which they analyzed blood samples from local healthcare professionals to see how Lambda affected viral infectivity. The Chinese Coronavac vaccination had been given to the health personnel in 2 doses. The findings, which were published on July 1, appear to show that Lambda is more infectious than Gamma and Alpha and is better able to evade vaccination antibodies. Our findings indicate for the first time that mutations in the Lambda variant spike protein confer escape from neutralizing antibodies and enhanced infectivity, the researchers said. A group of researchers in Porto Alegre investigated a patient infected with the Lambda variation in Brazil, where Gamma has been the prevalent strain. Given how quickly this variant has spread across Peru, Ecuador, Chile, and Argentina, we feel Lambda has a significant potential to become a variant of concern, the researchers said in an unpublished report. The pandemic has wreaked havoc on Latin America's economy. It has 20% of the world's coronavirus cases, while having just 8% of the world's population. In recent weeks, there has been an increase in cases in Colombia, Paraguay, and Uruguay. Well, that's all I have for you today. Thanks for watching. If you liked the video, please hit the like button. If you want to see more videos, hit the subscribe button. And if you have something to say, please leave a comment.